Joining me now is Dr. Gerald Fitzgerald. He's from Fitz Tropic Family Care with Pure Life. I lost the clinic. What's the name of the full clinic?
Pure Life Medi-Spa is my wife's place, of course. I'm right next door at Fitz Tropics Medical for the family.
But today we're going to talk about a medical application that's actually been around for a while. It's a new application use for an old technology, so that's kind of a cool piece for it. So we're talking about a lunchtime facelift. So tell me a little bit about this. It's FDA approved, and it has minimal stuff as far as pain, and there's no cutting and no nipping and tucking, right?
Yes, Dr. Shuck, it's really fascinating. They're taking a 25-year-old suture material called PDO thread, polydioxanone. That thread can now be used in the face and in a lot of other areas for aesthetics, facelifting, a lunchtime facelift. This suture material was used 25 years ago in pediatric cardiovascular thoracic surgery, pediatric heart surgery.
Yeah.
So anything that could be approved in a child is, it's very safe. So this material gets absorbed over a 6-month period, and it's fascinating for aesthetics.
Yeah, so when we look at it, you're basically kind of sewing the face up. But you were talking about it before. It has the special little pieces where you can pull it and it'll stay in place. And the suture, while it goes away, the effects don't. So tell me a little bit about the technique itself.
It's so fantastic because a lunchtime facelift for areas where you can pull the face up like this, you can actually do the neck and any lines in the neck. And depending on the different kinds of threads, there's a smooth thread and a barbed thread. The smooth threads can kind of give you that, flattening out of the area, where the barbed threads can actually do some lifting on the sides. And you can actually lift at lunchtime instead of getting a facelift.
So I'm going to go in, I'm going to have some lunch, and then I'm going to come in and visit you, and 15, 20 minutes later, I'm going to be beautiful again,
well,
right?
You're already handsome, Dr. Shuck.
Oh,
But it's really fantastic for people that have minimal sagging. It's not for like really big wobblers and things like that, but for as we're maturing, and we're maturing together, as this area comes down, you can actually lift that. You can do the lip, you can do submental, you can do neck, and it's minimally invasive, and it's suture material that's been around for 25 years.
So the average person's going to come in. You're going to make sure that they're not too much and that they're going to get some benefit from it. Does it hurt? What do you do with them? I mean, there's tons of questions they're going to have with it. Is basically, it's going to hurt, and how long is it going to last?
That's fantastic. It's minimally painful. It's like a bee sting with the numbing when you put the needle, where you're going to put the needle to thread that thread to the area, and then you pull the needle out and the thread is left in place. Whether it's the neck, right here on the side of the face, and it lasts, my God, it builds the collagen forever. Once the threads are placed, you get results for several years, of course, and it stimulates collagen production where the threads are left down, but it's immediate gratification as far as walking out with a lift.
Right, so obviously the short term is the threads holding, but the long term is the collagen that's regrowing, which is normal, which is what you have in your body.
Exactly.
So very little rejection, very little issues with infection. Any complications that you've noted?
We have been over 500 cases. We're very blessed with no complications at this time. The usual things, pain in the area, pain in the site where you put the needle to transverse the thread into the area, a little local discomfort, but that's about it.
Okay, and obviously you said you've done over 500 cases. Results must be pretty good because you're here with me today. Standard results, what are people coming in for mostly, and how happy are they when they go?
Oh man, mostly it's the neck and the jawline. Mostly the neck and the jawline. We can do arms, abdomen, legs. These threads can be placed in a variety of areas. I think the best thing is to look at the before and after pictures and judge for yourself.
Sure. Now, is anybody excluded from this? Who would be someone who shouldn't have this done?
That's a great question. People on blood thinners, or they're taking Xarelto or heart conditions, stuff like that. We want to talk to them first. They're still candidates, but we want to make sure that they don't bleed or have excessive bleeding in the area.
Right, and since it's minimally invasive, obviously done in sterile or semi-sterile pieces, the chances of infection is low, but we also have to know if people have immunoproblems, infections, and I'm sure diabetics have a little bit of an issue with it as well.
Exactly. We want to make very careful with diabetics, and of course we screen those out and say, listen, are you a candidate or not? And because they're high risk of infection, as you know.
Right, and obviously this is something a doctor should do, and obviously you're a doctor, but the screening portion of it is probably as important, if not more important, than the actual procedure itself.
Yeah,
and a lot of these other places will have other people doing it that aren't really doctors, and they don't do the screen.
That's true. The screening's got to be done by the clinician, of course, before this is done. We've got amazing nurse practitioners and PAs who have gone through extensive training to be able to perform this as well under my guidance. So as long as it's someone that has gone through the training, the extensive training to be qualified to do this procedure, that's the most crucial part. Yes, sir.
Sure. Now, obviously, It's the holiday seasons. People are on a budget. This is obviously going to be faster, so you're going to have some results for Christmas. But cost-wise, what do you think?
Well, it's way less expensive than a facelifting, of course. And it depends on the number of threads and what you're looking to achieve. The number of threads in the area and in that area as well. Anywhere from like 1,000 to a couple thousand to more, depending on how many threads are utilized.
Sure. And as far as we know, this has been done, well, it's been approved in the United States. So tell me the time for approval pieces. You've been doing it for over a year.
Yes.
And as far as we know, you're pretty much the main one in Pinellas County?
As far as I understand, I think there are some other places in Tampa that are using this technique as well with really good success. Being that it's been around for 25 years is the most important thing as far as the material.
Yeah.
Then it becomes a great question. It becomes dependent on the practitioner doing the procedure. So I strongly recommend you vet your people, you look at the before and afters that clinic is actually achieving. So that's a great idea. That's a great idea.
Now, Pure Life's been doing it for a year. You
Yes,
said
sir.
you've done over 500. You'll have some before and after pictures website-wise, so people can actually look at it. Shop online seems to be the primary thing in this season that we're in.
I think it's great.
I think it's very helpful because it lets people go through it. Anything that you would like to tell the people out there for these facelifts? Anything that they should know beforehand? Anything they should do during, and anything that afterwards?
I think the most important thing is getting that one-on-one consultation to see if you're a candidate, what you're trying to achieve. Can that be achieved with that technique? Because some people, as you know, they just can't have that done. And
Right.
you want people that are known to be really honest and good integrity in the field that does that on a regular basis. Because some people might sell things that maybe they can't really achieve. So I think that's crucial. I think that's a great point, actually.
Yeah, the expectations up front, making sure they understand the whole picture, make sure they understand any and all complications if possible, and then going through the process with them. They can see, do you have the procedure? Does anybody see the procedure? Do you have like examples of it?
That's a great idea. We do have some YouTube videos of a lot of the things that we do. We'll have to produce one of those so they can actually see the procedure getting done. We'll do that next and hopefully get that online. But the before and after pictures and the individual consult, I think, are crucial.
Yeah. Great information, good time for the holidays, obviously instantaneous results with long-term effects, great idea for most of these things. Safe, pre-screened by your clinician to make sure that individual knows what kind of issues they have and expectations up front. So nice to hear from you guys. Pure Life, MediSpa, next to Fitz Tropic Family Care. Thank you so much for joining us today.
Thanks, Dr. Shuck.